Hey you guys, we're here today at the end of the day at Dr. Emer's office, and we're doing some combination therapies. I'm actually going to be doing an IPL on this patient. She's such a amazing patient, always willing to kind of take, do different treatments for different things. And why I like this is because as women, I was just telling her, even men, but more so women, we might not wear shorts, we might not wear short sleeve shirts, but we always show our face, neck, and chest. So having these areas uniform is essential to me for skincare, for looking at your skin, looking at its best. So she has a little bit of rosacea. That's kind of, you can see the redness throughout the cheek and nose area, a little bit onto the forehead, called the butterfly mask. But on her chest, she has quite a bit of pigment. So what we're going to do today is a photofacial. This photofacial has kind of a couple different things that it can do, but we're going to pull the redness out. We're going to target the hemoglobin in the skin, which is what creates redness. And we're going to reduce the redness that you see throughout this area. I cannot change the body's ability or kind of the process of it having rosacea. It's an autoimmune. But we can improve the appearance. On the chest, we're going to target the chromophore, so what creates the brown in the skin, and we're going to lift that off to try to create a nice even tone and texture throughout the whole area to give her a nice improvement. So we're going to start here on the forehead. Now this is where she has more redness, so I'm going to change some settings around. As far as downtime goes, pretty minimal depending on how aggressive we treat. She is a nice fair type 2, so we're going to be able to treat her a lot more aggressive than we can our darker skin types. So just for those watching, this light is very bright. Here we go, 1, 2, 3. Okay, here we go. So photofacial lights are very bright. I have a non-scattering lens on it, but if you have light sensitivity, this might not be the treatment. We have other options for that. Here we go. So anytime we treat on the forehead, you're gonna have more heat absorbency because we don't have much cushion there. So I always like to start on the forehead because the forehead, to me, is one of the more spicy areas that we treat. Now she's not going to get clearance in one treatment. She will notice an improvement, but really you want to do a series of treatments, 3 to 4 treatments over 3 to 4 weeks apart, and then some type of maintenance treatment is going to be necessary. Here at Dr. Emer's office, we are blessed to have a lot of different modalities to treat. So we have 5 different vascular lasers, and depending on what we're trying to achieve, we can do a variation or a combination of those to achieve the best results. And we all have on really pretty green glasses, by the way, so we could be safe. That looks really good. I'm also going to treat her chin under the same area. Can you bite your bottom lip for me? Perfect. 1, 2, 3. Now, IPLs are one of the highest burn rates that we can get, so it's really important that you go to a physician or a nurse that's very highly qualified, so you reduce those risks for it. Laser hair removal is another one. So we always like to treat safely but effectively and get great results. You can already see the reduction of the vascularity in her chin. I love that. Looks so good. Do we have any questions, you guys, about what we're doing today? Or for those that are just tuning in, we are doing a photofacial on this patient to reduce the appearance of brown and red in her skin. That way we're not using multiple lasers to do it. It's just an effective way of pulling up different skin issues that people have. Okay, so now I'm going to change my setting again, and I'm going to target more of the brown. How do you feel? Does it hurt? You can relax your
A little.
A little spicy? That's one of my favorite words for lasers, by the way. Okay, here we go. Go ahead and turn your, there we go. You guys can see here she has more pigmented pigment on the jawline. A lot of times when we have pigmentation, there's a mix of red and brown. It's called red-brown dyschromia. Very common. Even in melasma, there's a mix of red and brown. So we might treat one and then another one becomes more apparent. This laser does target both very effectively. If we were going to do just a vascular treatment, we might use something like the XLV and the Laser Genesis, especially in her skin type. It's safe and extremely effective. The downside is it causes a lot of swelling for people that have that, so this is going to be kind of an alternative, so she won't have as much swelling or downtime. Also, you can treat hair with this one, so I love that. So you can see, I don't know if you guys can actually go in here. Initially there was a lot of brown. We actually, what I see now are more vascularity, is more vessels. So the next treatment we might change up the settings a little bit and treat more of that red once we pull the brown out. No questions so far? Go ahead and turn the other way. All right.
What device are we using?
This is a very cool, we've had multiple devices from this company. It's Venus is the company, but it's called the Versa, and it's a multi-platform device that does a little bit of everything. So we can do skin tightening, we can do improvement of texture, doing a radio frequency microneedling, and then this is a photofacial. So you're able to do all three treatments in the same day, getting improved results than just doing one treatment or just doing one device. So it's kind of like the new age right now. I think there's a lot of devices that are coming out, especially for those that they maybe have, I call it a real estate issue, where they just don't have a lot of room. This is a very compact device and it does a lot of different things. So it's a good price point for the patient and the provider. So this one is the photofacial that we're doing right now, targeting the red and the brown in the skin. And we're going to be doing a face, neck, and chest treatment to try to improve the overall tone and texture to give her a nice, even appearance. So stay tuned today, you guys. We're going to have a lot of lives. Doctor's going to be doing stuff. We're all kind of in different rooms doing different things. So stay tuned.